So we're talking, this is a food policy and food politics podcast, but you can't separate food policy from healthcare easily. And I want to quote, this is a report from KFF, which is, I like to think of them as the artist formerly known as the Kaiser Family Foundation. And they say that the majority, 78% of people who received SNAP benefits in 2022, which is the most recent data that they had, were covered by Medicaid, including 18% who were covered by both Medicaid and Medicare. So we're talking about really talking about in a lot of ways, the same pool of people being
Yep.
cut from both directions. That's why, and I want to toot our own horn here a little bit, Helena. Why does it matter to follow food policy and food politics? It's because it's at the center of everything that's happening in this country. People
Yeah.
tend to think of insurance, healthcare maybe being more important, but they really are one and the same thing, right?
Yeah, and we have seen way more focus on Medicaid,
Yeah,
which is, I think goes to
more
back what you were
popular.
just saying.
Yeah,
Um, I think I think we just tend to think of healthcare as a more pressing thing, and I get it. It is like very important to have health insurance like that or coverage under Medicaid. It's huge, but the SNAP cuts are going to be um, really widely felt, and also they are going to I think affect people more quickly in terms of just like the impact of it. You may not realize that you've lost your Medicaid coverage until you try to go to the doctor. But the SNAP requirements changing will affect people a lot more quickly because SNAP is a monthly program. And so, we'll have to see how this all plays out. I think some states will do more to make sure that their participants in their SNAP programs can stay on the program, like helping, there's a way to design all of these systems to be like easier to use or harder to
yeah,
use. Harder to use is a great way to kick people off. Like I was reading about the Medicaid work requirements that were tried in a couple of states, including Georgia, and their website would just be down like a lot,
yeah.
for updates. Well, that I don't know if that was intentional. I'm not saying it was, but like that's a really good way to just, I mean, people just give up. They're like, well, this isn't working. And they had to check in like monthly to stay on Medicaid. And so, I mean, that's just a really big administrative, I
Well, the
struggle to like get the
cliche.
kids
Yeah,
paperwork for school, like when that's
yeah.
once a year.
Yeah.
It's
The
not a small
cliche about
thing.
the states being a laboratory for innovation, right? Like you've heard that before. And
And they
we're going to
are.
find out.
And they are. Yeah.
We're going to find out if they really are. That is about to happen.